సెకండ్ అట్లేదా?
Okay. Good morning, everyone. How are you all doing on a rainy winter Sunday morning? How is it all with you? All fine, ma'am. Thank you. Thank you for the response, Fatima. So we'll wait for a minute more. Let others join. So meanwhile, we can interact. Like we have Fatima, Hina, Shriya, Supriya, RM, maybe Ram. Okay, hope all of you are doing good. Yes, we all are fine. Thank you. Hi, Soumya, Neetu. Hi, Revati. Okay, and Gayatri. Hope you all had your breakfast and done with your work, and hope your Sunday morning is more relaxing. And also to listen to our speaker today. Hi, Maheshwari. Okay, wonderful. So let's begin. Thank you, guys. Thank you all for joining us today. And today, let me introduce the speaker of the day for you all. So the speaker who has come to talk to you all on the 23rd session that we are conducting for the National Awareness Campaign is Sandhya. So Sandhya, she has done her master's in food and nutrition, and she's based in Hyderabad. She's a holistic nutrition coach and a certified diabetes educator with 10 plus years of experience. She has worked in multi-specialty hospitals and given talks on nutrition and health in corporates and government hospitals and government organizations as well. Her area of interest lies in reversal of various lifestyle diseases like diabetes, hypertension, thyroid management, etc. Her motto is to bring awareness on integrated medicine. Her vision is to see the holistic approach in healthcare as unique and the most effective way to treat all disorders and diseases and decrease the dependency of medicines and their brutal effects on the human body. She always believes that you are not only what you eat and absorb, but you are also what you think and believe in. So let's welcome our ambitious and dedicated speaker who contributes her services in relieving her client health issues. Hi, Sandhya.
Thank you so much. Hi, Jyothi. That was a warm intro. Thank you so much.
Okay. So hope you all know what topic we are going to talk today, guys. So let me start. Like the moment the general saying, when we say someone is upset, someone is furious, someone is angry, what is the general saying that people tell him? Oh, cool down, your BP is going up. Have you all heard this? Anytime? Your parents, your grandparents, your friends saying, cool down. Don't be that anxious. Don't be that angry. The BP is raising up. Is it right?
Sometimes Jyothi, it is sometimes the other way also. The person who is getting angry, he himself alarms that don't raise my BP or don't, I'm warning you.
That's where the self-consciousness comes. We will definitely go there right away. So that is a topic for today, guys. Hypertension. The BP, the general term that we all refer is hypertension and BP. So as we all know, BP is something that, it is there inside the body, but it's not so easy to actually realize whether it is high or low or normal or whatsoever, unless otherwise the person is really aware of the condition. Since we are not aware, it's not even that okay to leave it aside. It has its own repercussions, it has its own complications, because We all are aware and heard from multiple times through all these decades from various multi specialty healthcare professionals that diabetes and hypertension are the two dangerous things which can impact anything, along with obesity. So, having said this, that's why it's very, very important topic for us to know more about it. So, um, let's welcome Sandhya with the first question. Sandhya, throw some general information on what is this hypertension is all about.
Yeah. So before I answer, thank you all of you for joining, and thank you all the team H3 and Heal Thai team for giving me this opportunity. I shall do the best, whatever I've learned. I'll try to share with you all my experiences and my knowledge with you. Thank you, Jyothi. So coming to a layman concept of hypertension, as the name itself suggests, the pressure, the blood pressure, right? So we all have blood pressure, but we all don't have the hypertension. So the blood pressure is different, hypertension is different. Okay, so the blood pressure is the speed or the pressure with which the blood flows against the artery, the walls of the arteries. Okay, so it's like if you take a pipeline and you see the water flow, it is exactly the same mechanism as the blood flows in our blood vessels. So the pressure which is exerted with the flow of the blood is nothing but the pressure, and in some cases this pressure goes high or goes low. So this pressure is measured in terms of with what kind of pressure it is flowing in the vessels. So when the pressure is very high beyond the normal limits, then it is called hypertension. So we have an estimated and a setup standard rule, or a setup standard maximum normal flow, which is 120 by 80. This 120 is the systolic and 80 is the diastolic. 120 is in the contraction and systolic is simply when these vessels or the blood, the walls relax. So this is measured in millimoles for mercury. So when the normal limit, when the pressure is more than the normal limits, then it is called hypertension.
Right. So, guys, this is as simple as that. If you have a pipe of water and you have few plants at home, and if you have the habit of watering them every day, you know very well. If there is a large force of water coming up suddenly, and if you just shoot up the plant with the water amount of water that is coming, what happens to the plant? It just gets bent away and it can uproot also at times, depending on the force and the volume of water and the pressure at which the water is actually coming out. The same thing is happening to the body with the hyper blood pressure, which is nothing but we call it as hypertension. So the other way around, if the pressure is low and when there is less of water, that is not sufficient for the functioning. So this is basically what is the pressure is all about, which is on the blood. So, but hypertension is different. It is not the BP. BP is, we all have the blood pressure, all of us, but when it is really alarming and raises high above the normal level, then we call ourselves as hypertensive. So, having we discussing about being hypertensive, what are the predisposing factors? What are the causative factors? Like why we have so much of global burden of hypertensive cases these days? If we check, it is 10 people, 8 of them are suffering for this. And even if not, people started checking each and every day. Most of them they have equipment at home and this self check. And whether that is true or not, that's a different story. But people, they adapt that and they go into the frame that yeah, our BP is high and we have to do something, and they eventually take a decision to. But so, is the right way doing? What are the causative factors? Then we will go to my second part of the question. But first of all, I want you to discuss with our audience today what causes hypertension.
Yeah. So we all know that we've been hearing this hypertension uh, said as the silent killer, right? So what is the silent killer? We don't use this term with other diseases for diabetes or obesity, all this. But why only with hypertension? Because hypertension is not something which you get it in past 3 years, 4 years. Actually, the symptoms are not expressed into our body. The symptoms are not expressed so profoundly that we don't think that we have this hypertension developing in our body. So it is referred to as a silent killer. Anytime it may burst out. Okay. So coming to the causative factors, the etiology, there are two factors which can be, sectioned into a modifiable factors and a non-modifiable factors. Coming to the modifiable factors, the name itself suggests can be modified. So the main things exist are your lifestyle, your physical activity. If you're very inactive, yes, you're more prone to getting hypertension. And the most important factor is your dietary habits, how you're eating, why you're eating, when you're eating, how much you're eating. All these clubbed together comes under the dietary factors. And coming to the non-modifiable factors, there are some comorbidities which body has. So due to this, hypertension comes as a byproduct of this. The most important non-modifiable factor is the diabetes. Insulin plays a major role in hypertension. When there is insulin resistance, when there is no proper secretion of insulin, and when there is no control on that sugar levels, yes, there is 100% chance that your pressure increases and results in hypertension. So the other comorbidities includes the CKDs, the chronic kidney diseases. All this comes into the non-modifiable risk factors. And apart from the cigarette smoking in the modifiable, inactive lifestyle, and on top list lies the emotional distress. The emotional distress is the number one cause these days in modifiable risk factors. Recently, in 2022, we celebrated the World Hypertension Day, May 17th. There, WHO have come up with beautiful guidelines asking for the modifiable factors. If we correct these modifiable factors, can someone mute Ganga?
Yeah. Go ahead,
So
Sandhya.
they've come up with a beautiful take-home message saying that if we can prevent these modifiable risk factors, absolutely there is no landing of these non-modifiable risk factors. So the prevention is more important than managing the symptoms of hypertension. So yes, it is, these modifiable risk factors, which are, if not controlled, may lead or may take us into this non-modifiable risk factors. So these are the two classifications of causes.
Wonderful. So, guys, as you all know, and as Sandhya rightly pointed out, why do we call all these things are lifestyle diseases, the hypertension or diabetes or whatever, the obesity? We call them as lifestyle diseases. Means the main causative factor is the way we live, the lifestyle of a person. If that is really in a right way, then it will not let the other things happen which are not modifiable for us by us. And then eventually we can prevent them as well as these from getting them if a person has a good lifestyle. And coming to my point, which I was discussing earlier, Sandhya, like I was talking about every household, every single household has a not the manual sphygmomanometer, but they have a BP operators, which is digital these days. And people are behind it, checking each day whether they need it or not. It has become a ritual for them, most of them. And they assume themselves as being hypertensive also at times. They go to doctors and they keep checking. So even before doing this, because this ritual was not there earlier. If you see 10 years before, people used to religiously go to your doctor to get it checked.
Yes.
But now the case is not that. Okay, the healthcare professionals were set aside. Even the general public is taken the decisions in the mainstream, and they were self-checking and realizing and coming up their own notions. So my question to you is, even before doing that, what are the checkpoints that people should check on? What are the symptoms? What are the things that they should realize even before they check their BP every day? What should be the signs and symptoms, to put it in a simple way?
The signs are very profound when once the person is getting into the hypertensive stages. Okay, it's not that hypertension suddenly comes. So we have stages, like we have elevated stage where the blood pressure goes beyond 120. Okay. And if the elevated stage is not controlled, then body slowly starts giving us the symptoms, which is the stage 1, where the pressure goes beyond 129 to 130 also, even to 139. Okay. And this is the point where, body signals. Body gives blurredness of vision, and body gives, anxiety issues, and sleep depression. And people don't actually concentrate on their daily routines also. They feel like, their head is loaded with a lot of load, and they feel like, they're not able to concentrate on their daily works. Memory loss, all these kind of symptoms are seen when the pressure is gradually taking up. And when in the stage 2, when the BP is more than 140, and the diastolic pressure random increases to more than 90, and that is a stage people go into a deep sleep, or people feel like, they are feeling dizzy. And eventually, when the BP is very high, the most important thing you get is the blurred vision, and the headache. These two things, they should check what is it that is going wrong, and immediately they can have this check at home. Like, most of them are nowadays equipped with the either the digital one or the automated one, right? These mercury sphygmomanometers they don't use, because it needs another assistant to check. So if you want to self check, it is better to go for a digital or an automated blood pressure equipment.
Good. So these are the things that you have to check on, guys. Even before checking the reading in emission, sometimes what happens, this is a general thing that we all have observed. When we feel like checking the blood pressure, even before making a reading out of it, even before attempting to do it with an automated machine, we feel like the BP is really going up, because the person eventually becomes very anxious and eager to know what is happening with him or her. That also can trigger, you know, the situation in which the person is. And also, one more symptom that I come across with most of my clients is some, not with everybody, few, they may even see the palpitations, because they get to feel the heart rate. It will be, my heart is rushing high. They get that kind of feeling. So these are the things that you have to keep a self check on oneself. Once you keep noticing yourself, your body will tell you hundreds of things about you. That is a direct information that which you can rely on rather than a mission. So we request you to focus on that before. And as we are continuously talking on the lifestyle diseases, and lifestyle is the thing which affects the existing disorders and diseases. So let's discuss more in detail about it. So we have exercise, we have diet, we have so many things which comes under lifestyle. Let me ask you about the food part, Sandhya. Can you detail us what are the main things? What is the role of food or the role of nutrition played in developing hypertension in most of the people?
Yes. So, as discussed earlier, as I pointed out, when it comes to the non-modifiable risk factors, the modifiable risk factors, I said diet plays a major role, because the sodium is directly proportional to your hypertension. Okay. In all the food items, naturally there is some amount of sodium present, but we follow different kinds of cooking processes, where we use the sodium to flavor, to enhance the taste, and for different purposes. Some use for preservation, some use for adding flavors, some use for other purpose. So the main concept in dietary comes is the amount of sodium that we use through the diet that we take every day. Okay. The WHO and other organizations say every day they should not be a more consumption of sodium which is more than 500 milligrams per day. So when you take a teaspoon of salt, not tablespoon, guys, a teaspoon, which is 5 mg. So in this teaspoon of salt, almost there is 2300 milligrams of sodium. So just think 5 grams and then 2300. 2300 is when you see it in 5 grams, it is coming around 15 milligrams. Okay, if you convert it into milligrams, this 5 grams comes to 15 milligrams. And when you see 1 teaspoon has 2300 milligrams. So we are using almost the double quantity. And it's not that 1 spoon, we stop at 1 spoon. We take, we cook it for a family. And when you see the average, or when you see the individual consumption, in each meal, we take more than 1000 mg. Only through our 3 major meals. What about the drinks that we consume? What about the side dishes that we use? What about the other junk food that we use? If we count all of this on an average, we are taking more than 3500 milligrams of salt. And over a period of time, if this is the kind of food habit that we are adapting, yes, eventually we are more prone to get this hypertension. Okay, so using the table salt and adding extra table salt to enhance the flavor. Some people add, salt even when they take salad, or when they take curd, or when they take some kind of, fruits, like you say, raw banana or guava. These are the things that we need to cut down. And some people have the habit of adding salt to rice while cooking rice, while making rotis, chapatis, all these breads. So these are some of the things where we have to be very mindful, and we have to be very choosy in using the amount of salt, because the woman is the main pillar of the health of the family, because she commands the kitchen, right? So she should have this command, and she should have this control on using the salt. If woman uses more salt, that means she's creating, a lot of chaos in the family by giving hypertension to all of the family members. So it is the women who should be very
On a
relaxed.
lighter note, let me add one thing here. Guys, I need your response in the chat box. After your cooking is done, how many of the family members complain that there is no salt? Say yes in the chat box. I'm the first one. How much ever salt I may add, my husband always claims it is less. So how many of you find the same? See, Fatima says yes. Kamaram says yes. There's a lot of people who think that how much ever salt it might be, because it's always a kind of taste adaptability. You go ahead adapted to one particular taste, and even if it is slight variation, people don't accept it. But the same thing, if you get used to the lower range, you get adapted. I cannot even consume a bit if it is more in salt, because my adaptability is at that level. So salt is something, as Sandhya rightly said, there is a lot of invisible sodium already existing in foods, which is sufficient. If you listen to Manthan Satyanarayana, I don't know how many of you follow him. He says no salt food, no oil food. At least we don't ask you to do the same, but use in moderation. It's very, very key. And also, what about the processed food, Sandhya? Can you throw some light on that?
Yeah. Processed foods these days have become the, easy picky foods. Slowly we are going to that trend where people stopped cooking at home, certain dishes or certain special things, and they are relying on these easy to purchase processed foods. For example, you take the pickles, you take the fermented foods, everything you get in packaged foods these days, right? And what is the main thing that these packaged foods are staying long in the market, or staying long in the the cupboards which they are stored? It is the preservative, and the main preservative is the salt used there, right? So this processed foods are the major reason in the dietary factor, which plays a major causative factor. So be it any processed foods, the main preservative item is the salt. Be it any salt, be it potassium salts or or iodized crystals or sodium crystals, any salt, this salt is capable of increasing your pressure in your body. So processed foods, using your processed foods in your daily routine life, because I come across so many clients, where they start their breakfast with processed fruits. They purchase this ready to eat idli dosa batters, and they are ready. They use this processed ready to cook this curries. Just they have to pour the curry and eat it in the oven and serve it. Okay, all these things eventually when you prolong to eat it on a longer duration, yes, processed foods plays an important role. And it is not that processed foods, yes, the cold storage foods also, even that is a kind of processing, where the main preservative is salt again, because no bacteria grows in excess sodium alkaline content. Because of this, the shelf life of these processed foods is prolonged more.
Right.
So yes, processed foods are a big no when you want to adapt certain healthy lifestyle habits.
Yeah. So guys, the basic mantra is everything which comes in a packet. All the savory, especially that comes with extra salt. It's a lot of salt in it, and they add a bit more in a different forms. It's not only
Flavors.
the kind of salt that we actually take. Apart from the salt that is for the taste, there are salt in various other forms which actually helps them to increase the shelf life of the products. For example, the canned foods. The consumption of canned foods is a much lesser in India, but if you check across America, US, and Europe, and across, the consumption of canned foods is so high because it's so easy. Get a tin, open it, and your meal is done. If you want to make chole, no need to boil the chickpeas, no need to soak the chickpeas. There is no janjat, nothing done. It's so easily done. So people adopt to these easy lifestyles so quickly because they think it's very,
time consuming.
good. But at the same time, please realize the amount of salt that is there in these canned foods and all processed foods. It is really damaging wherever we are now. So also, I have one important question for you, Sandhya. As we are talking about processed foods and especially sodium, there is a lot of research or awareness among the general public that which salt is good. Is it table salt? Is it iodized salt? Is it non-iodized salt? Is it rock salt? Or is it black salt? Or is it Himalayan pink salt? The queen of the salts. So which salt is good? And many of them think that the Himalayan salt comes with much minerals, though it is expensive. They think it is healthy, though it is sodium. So what is your take on this?
So I have done extensive, background for this. Not now, not for the session, but when I started taking my first client, it was last year actually, and I started asking her what kind of salt they use, and they said right from her, married life, they've been using this Himalayan pink salt only, because somebody told that rock salt is very dangerous. Because of rock salt, the sodium levels go high, and this iodized salt is also not so good. So they switched on to pink salt. So ever since I met that client, I started reading about what, because I never used a pink salt. I never used Himalayan pink salt. We always use the iodized salt or the rock salt crystals. So it was there are so many studies. The CDC, the Center for Disease Control and Prevention, came up with lot of evidence-based data studies saying that there is no perfect salt. There is no ideal salt to use. Be it Himalayan salt or kosher salt or any salt, the sodium content is more or less the same. More or less the same. And talking regarding the Himalayan salt, it is a bit ahead of these salts, because this Himalayan pink salt, the color pink is due to the different kind of minerals that it takes when it flows. Okay, apart from the potassium, magnesium, and calcium and other ions, it has the trace minerals like molybdenum and the manganese, zinc. These trace minerals are abundantly, almost there are 80 different kinds of trace minerals in Himalayan pink salt, and that is the reason they use that is the reason that salt adapts this pink color. So apart from that, there is much superiority of there is no superiority, or there is no advanced benefits of this using Himalayan pink salt. And coming to the iodized salt, using this iodized salt in a way is good, But when you iodize it, when you fortify the salts with iodification, there are a lot of minerals which are degenerated, which are getting, affected in the processing unit. So using iodized salt to some extent is okay, but when you combine the usage of rock salt as the crystals and Himalayan salt, it benefits a lot. Because ever since the Tata company have come, that has become a marketing strategy of using iodized, and people are more interested in using the free flowing salt, not the crystals, because crystals getting stuck with the food products while we eat, and the free flowing salt is very easy, we don't see it. But the darkest part is when this iodification is done, the natural elements which are coming from the sea, the source of salt, are degenerated. So use iodized salt only when you have iodine deficiency. Now it has become a blanket rule that everybody uses iodized salt. So
Yes.
using Himalayan salt is not a bad thing. You can use it, but using rock salt or using the iodized salt should also be taken into consideration by rotating. Don't just stick to one kind of thing. Either you blend the salts or you rotate the salts.
Okay, I have an interesting observation here, guys, for you all. See, say if a person is using Himalayan pink salt for the sake that it has some extra minerals, the Himalayan pink salt costs for example, around 200 rupees per kg of salt. If you take a normal salt, which is a Tata iodized salt or free flowing, any kind of salt, it costs around 25 rupees, which is 8 times more than that. So my question to you all is, if you want to use pink salt for the sake of the extra minerals that are there, let me all tell you, all these minerals, they are volatile as well, most of them.
Yes.
And they are lost in the cooking process, and they don't retain till you actually eat your food. And secondly, if you really want to get in so many good minerals, you have lots of fresh produce like fruits and vegetables, which you can happily rely on and which you get 10 times more than what is there in the salt. So please understand the logic behind. If it is beautiful, if you want to use Himalayan pink salt, use it as a top up for the salads or certain things where there is no cooking involved. If it is for general cooking, just go ahead with your original traditional practices. That is where the best you can get it for. So that's a lot about salt. So let's go ahead further. Let's talk about lifestyle, Sandhya. So what do you think? How is inactivity and sedentary lifestyles are affecting the rates of hypertension?
Coming to the inactive lifestyle, this is one of the modifiable risk factors as discussed earlier, right? So when the pressure is more in the arterial veins, the pressure, it is because when your body is inactive, the contraction and the relaxation processes are more affected, because the muscles which surround your arteries or any of your organ, okay, they are surrounded with lot of fat deposition, right? So we come across this metabolic syndrome, this term. So when this metabolic syndrome exists in any body is, you have to remember 2 points. When you take your lipid profile or cholesterol profile, look into two things: whether your HDL is very low or whether your triglycerides are very high. If your HDL is very low, it means obviously you're inactive. If your triglycerides are very high, obviously that means you are eating a lot of saturated fats. When these two exist, obviously you are more prone to hypertension, because the metabolic syndrome is a predisposing factor for getting hypertension very soon. Okay, so when this high density lipid proteins are very low, it is a clear cut indication that the person is inactive, physically inactive. Okay, once a person gets physically active, the pressure with which the blood flows, okay, it is drastically cut down, because when a person is doing some sort of physical activity, the vasodilation of these blood vessels expands, And when this expansion happens, the flow of the blood, the gap, the area where the flow of the blood increases. So there is no contraction of these blood vessels. Okay, so the vasodilation increases when a person's physical activity is increased. So physical activity, be it any kind of physical activity, you do your personal takes, you do jogging, you do yoga, you do walking, or you do some kind of equipment exercises. Yes, because of this, the vasodilation occurs. When the vasodilation occurs, the expansion is more. So the area, the surface area for the blood to flow is more. So this is the role of physical activity to cut down or to control your high blood pressure.
Okay, that's wonderful. So, how actually sedentary lifestyles are actually increasing? Um, can you put it in a more easier way to understand? Because this vasodilation and all are so difficult terminology for the general public.
Yeah.
So, can you actually tell people what exactly can be done and what is harming them?
So vasodilation is a simple term because we have this pipe which is called as blood vessel. Okay, they contract like this, and they expand and they contract. And this expansion, if it is not happening, the contraction is more. When the contraction is continuous and the volume, the pressure which the blood flows increases, so there should be a optimum level of expansion, which is called as vasodilation. The expansion should be maximum. Okay, and being sedentary lifestyle, so most of the people these days adapt to certain jobs. You especially take the IT fields. So most of the IT professions, from morning 9 to evening 9, they have this stable work. Okay, it is the desk job that they do. And you take the other government professions, you take the other teachers, anybody, there is no way that they have some kind of physical activeness in between their jobs, right? And if this repeats for years together, 10 years, 20 years, 30 years, and the roots are laid from there, right from your childhood. If your lifestyle is being very inactive, the kind of job, the profession that you choose is very no sedentary, then you should adapt to certain lifestyle modification, which includes the major parties, including certain kind of physical activities, the exercises, or any kind of thing that help you to reduce this sedentary lifestyle. And the other part is, most of the people, they think if they are thin, they are thin even though they are prone to hypertension. And if they're thin also, people think they don't require any kind of physical activity because they're maintaining their ideal body weight. But mind me, you all should understand this concept called tofu concept. People who are very thin also have the high levels of triglycerides, and they have high BP because they're still inactive. They don't adapt to any kind of exercise. That's why they'll end up getting this hypertension and the other lifestyle diseases. So it's not that if you're thin or if you're healthier or if you're overweight, you should have the option of choosing this physical activity. Anything physical activity should be a part and parcel of our daily routine.
Okay, wonderful. Team, can you please make me co-host? So guys, as it is rightly said, if there is no physical activity, the HDL levels, these are really a good markers for you to check on. If the HDL levels are low, it means a direct indicator for your inactivity. If that is the case, you please try to be more active, indulge yourself into some exercise, and make yourself try to be very active all through the day. And if that is done, on the other side, the triglycerides, which is a lot of intake of fat, which is a storage form. So one is from the food marker, one is through the activity marker. That's what actually helps you all to actually know whether you're inactive or not, and whether that is getting prone to hypertension or not. So having said that, Sandhya, are you around? Team, or is anyone around? Can you please make me co-host? Thank you. Okay. So we discussed a lot about inactivity and physical being physically active and fit and all. So one common concern that I have observing most of the people these days is um, a lot of self checking and self monitoring is happening, as I've said earlier. So having that in case, what are the things that we should consider if someone wants to record or observe their blood pressure at home or at a clinic or under the supervision of a mid-care person or a nurse? What are the precautionary measures and what are the minimum things that they should look for while recording a reading?
So very important question. So this is the main uh, point which revolves around hypertension always, because there are a lot of misleadings happening when you are diagnosed with hypertension. Okay, in this year 2022, May 17th, the World Health Organization, the theme of the Hypertension Day is that measure your blood pressure accurately. Okay, control your blood pressure, live long. This is the slogan or the theme of this 2022 World Hypertension Day on May 17th. And ever since this has come, the propaganda, the kind of awareness that the Indian government also initiated with a name called India Hypertension Control Initiation. They have expanded this knowledge in such a way that in all the community health checkups, the primary healthcare centers, the clusters, be it any kind of healthcare centers, they have distributed a lot of automated blood measure BP apparatus, because the advantages of BP the automated blood pressure apparatus is it doesn't require physical deflammation, whereas in the mercury you have to deflame it, and we don't know which person is deflaming it with how much pressure. And you're not required to listen to the sounds or the diastolic or the systolic sounds in automated pressure. And a person should can also be very accurate. The measures are the results come accurately on a display, whereas in the mercury you have to check the drop of the mercury line. So these are the advantages of using the automated or the digital apparatus. And there are basically certain procedure or certain guidelines when one self checks BP at home. It's not that you feel the giddiness, or you have your drink, or you have your food and immediately go and check. No, before checking blood pressure at home, just make sure you use a digital apparatus or an automated apparatus, and you are free of taking this your coffee or any beverages at least 1 hour before. Okay, after taking don't immediately check your BP after taking your drinks or beverages or food, smoking, alcohol, all these things. And the most important thing, when you're more joy, never check your BP. It goes very high. When you're more happy, when you're more anxious, anxiety is in both ways, and you're happily anxious and you're sadly anxious. Never check BP when you're in any of these two states. And obviously when you're angry, we'd never dare to check our BP, right? And there's no need to check our BP also. It is expressed into our body, right? So these are certain things. And the other things are, sit on a 90-degree position on a chair, and your legs should never be crisscrossed, right? And always when you're checking, start checking with the left arm, and use the this what do you say, the apparatus which is 90 degrees to your chest. You never put your hand like cross or down. No, just sit 90 degrees, and always make sure you wear very light clothes or sleeveless. Don't check on heavy clothes, because the accurate readings never come. So always make sure you are with sleeveless or with a very thin cloth. Okay, and use the band, just tie the band very tightly and check for 2 consecutive readings. So many people do this mistake that they check once the BP and just put the pen for take considering or for concluding they are hypertensive. No, just wait, check your first reading and wait. And if the results are high, take deep breathing and take 10 minutes time gap and check for the second consecutive reading. And if still the reading is more high, yes, you are hypertensive. And if the reading goes down than the first reading, come to the right arm. Come to the right arm. It should be parallel to your chest size, chest position. And then check the reading of the third reading from your right arm. And if the reading is high, yes, you are hypertensive. And if the reading is low, then take the the average of the first 2 readings which you have taken from the left arm. This is the thing. Mostly what happens, Jyothi, when you go to a doctor will not check. This is something priorly done. The nurse checks. The nurse will be loaded with all sort of things. She has to take care of the patients in one room, other room, and this poor lady checks the BP with all kind of tensions and this chorus of sounds she never notices. So there are so many misleadings happening. Sometimes a patient who is not having BP is labeled as hypertensive. Sometimes the patients whose hypertensions are whose readings are more high, they're labeled as normal. This happened and I have seen in my own practice.
Yeah,
so
absolutely.
Always go for a automated blood pressure apparatus and take the consecutive readings.
Yeah.
And don't decide with one first reading.
Yeah, exactly. And also I want to add a point. Sir, I'm coming to you 1 second. Also, I want to add on a point. Never check for a single day. It always has to be at least for a week. That
Yes.
you have to keep up a standard time. Say, for example, don't measure your BP when you feel like. When you think it is high, don't measure. You have to monitor your blood pressure at the standard routine timing. Say, for example, 8 a.m. in the morning, check for 1 week. 8 p.m. in the evening, check for 1 week. You have to check 2 to 3 times in a day consecutively the same timings for the same next 7 days or so. If the readings remain consistently the same, that's when we can go to a
conclusion.
Conclusion. Yes, sir, please go ahead.
Yeah, ma'am. Since you are going past clinical to lifestyle, yeah, I know I am not supposed to ask you the questions, but yeah, one thing, because Sandhya has beautifully explained about the salt, sodium, and all these things. So whether it is 3,500 milligrams or 1,000 milligrams, and Jyothi ma'am, I know she lived almost like a decade in Europe. She knows much about the canned foods. But when I was researching last night, I looked into, and more than diabetes, it is the hypertension, which is the biggest killer in India. Okay, we don't have canned foods, and I don't think like is salt the exact cause or the person. Okay, I would like to know the holistic approach to it, madam.
We are coming to that, sir.
Yeah,
Sandhya
thank you.
Yes, sir. The next part is that one only. Please stay tuned. So
very interesting part actually.
Yeah. And sir, the India is upgraded to such a level that there is nothing that is unavailable in India. Even the canned foods are available. People are opting for that. Okay, as we spoke a lot, and even the research says like earlier lifestyle was a reason for all these disorders, then your stress is a reason for all these things. There's an interesting question in the chat box. I think that would be answered as part of your discussion to what I'm asking to you, Sandhya. So the question was, ma'am, could you please explain how anger is related to hypertension? This you can answer as part of what I'm asking now. So what is the way we can see? People have tried all means and ways of using medication, visiting doctors, they've been doing, and we respect that. Absolutely. Because that's the first care of line of treatment for all of us. Having said that, but that is not sufficient, because there we are not sure whether the cause is rightly addressed or not. So, in this scenario, what is the better way, or a complementary way to the existing medical practice, which I call the holistic approach to deal hypertension?
So basically, just sir mentioned one thing. It goes like this. Though there are no canned foods in India, I remember very well this one word which is used by Dr. Hegde, BM Hegde. We all Indians are NRIs. He used this word because though America is not here, we adopt all, Western culture.
Absolutely.
We adopt Western culture so deeply that we forgot our roots, how we lived, what are our cooking methods, what are our food habits. We forgot that. So he used these terms, we are all NRIs, and people are proud to be NRIs. And I went to one of the clubs. It was in one of the societal clubs. I see to the each Indian family there was a US flag hanging. I asked why they're hanging. So it represents that they are NRIs and they get special privileges, special status being NRIs. So I just remembered that when Dr. Hegde used this word, we are all NRIs living in India, because right from the medication, right from the lifestyle, right from the food, we adapt to the Western culture only. That's why the major cause of deaths, the morbidity rate in US or all the Western countries is only because of hypertension. The next comes the cancers. The first position of morbidity rate or the factor or the reason is hypertension. Okay, so to some extent we Indians are blessed because some people are still stinging to that roots of our Indian policies, of our Indian customs, cultures, and the way we lived, right? So coming to your question, the holistic way. The word itself is the 360-degree angle of seeing a problem holistically, whole, right? So when you see hypertension, you should not always focus on, okay, because I had some financial issue last year, previous year, I was in debts, I had some family issues, I was having some crisis at home. All these things are just a superficial factors. The main roots are much deep rooted, and they started rooting much way earlier before you realized that you're going to get hypertension. Maybe it could be in your school age, because the kind of thoughts, the beliefs, and our personality, attitude, it's not something you get it when you're adult or when you're in when you get married. Of course, after marriage things are different, but all these basic things are adapted right from your growing age, right? So the roots are much, much deeper. So the way you think, the way your emotions are handled are all responsible. And there is also a paper from else journal saying that people who have lot of toxic emotions, they have done almost there were 1200 women they have taken into the study, and they've come up with a conclusion with two criteria: people with toxic emotions who hold and who express out. There were two versions of this pilot studies, and people who hold, they are more hypertensive, and people with toxic emotions who expressed out, they are comparatively less. So it is not that you hold your negative emotions, it is also important that how you are holding, are you expressing it out or not. So you say, sir, we Indians don't have this kind of things, but we Indians, not all the Indians, you see across the world, people are having different emotional life. A human body, be it any part of the world, have major three factors. One is the physical body, one is the mental body, and the energy body, right? And all the diseases are revolving around the energy body, which is our navel area, the stomach, right? And if this gets affected, and knowingly or unknowingly, we are treating the physical body. Okay, so it is very important that when a person is getting hypertension, don't just look into the dietary factors, the physical factors, just try to dwell into a deeper things. Trying the emotional side of that person is very, very important, because the root cause of this hypertension starts from there. If a person is very stressed, he picks up this finding pleasure of happiness in eating. So why the person is eating more junk food or salty food is this factor. Or if a person is very, very anxious, that means something must have been deep rooted right from his or her childhood, that this person is very anxious. You see, most of us, even I was the same, when we go to write an exam, we feel very anxious. Most of the people express this. They feel like urinating, they feel like visiting a washroom, and once they are relaxed, given the exam, be it whatever the result comes, whether they write it good or bad, they feel very relaxed. So why they're feeling that urine urge is because the pressure which is created on the bladder, though the bladder is not full, they still feel that they should visit washroom, because when they are anxious, when they are tense, the pressure buildup is more in our body. So this is the side there one should look, not only because of their financial factors, their problems, their family issues, their anxiety issues, their anger management. Beyond all this, one should also address the emotional health of a person. That is very important. If you correct the emotional side, these things are automatically corrected.
So well said. So well said. So, guys, the root cause of hypertension. So, here you go. If you all have thoroughly, consciously heard what Sandhya has said right now, the emotional distress, the kind of emotions that and the blocks we carry, the way we pile up things and we don't let it out. Most of the women, they don't, or women, mostly women are the most sufferers, even the men. They think that the wives don't let them talk. So I'll take the men also into consideration. Even the women and the men, they think that they don't have a feel to express, and because they have a fear that it will not be accepted. So they just stick to the point that they don't let it out and they just pile it up. The kind of piling up is nothing but the clogging, is nothing but the emotional distress, which is the root cause of most of the people who are suffering with hypertension. So having said that, it's not only the restriction of salt that you have to look into, as it has become a general norm that if a person is hypertensive, reduce the salt. Rather, it has to be the other way around. If a person has hypertension, please look into his or her emotions. So that is the holistic approach to manage hypertension, and Sandhya is an expert in reversing hypertensive cases. So if you want to contact her for further cases or case study dealings, please get back to us and we'll attach with her. And so thank you so much, Sandhya. It was a great discussion and we really, really got so much of beautiful insights and great learnings. And guys, I'm so sorry we are getting late for today, so I'm not taking, there are much questions I have checked. 1 or 2 questions were already answered in the chat box. And if you have furthermore, please drop it in a WhatsApp group and Sandhya will definitely get back to you and answer them. And thank you so much for joining us today, Sandhya. It was a great session, great learnings. We really, really have learned much deeper.
Thank you once again, team H3 and Jyothi, for giving me this opportunity. And thank you, Suresh sir, for being a backbone and just changing my perception of nutrition. Thank you.
Yeah, he's a backbone for all of us. So thank you guys for joining us today. We'll see you all next Sunday with another interesting topic. Have a good day, one and all. Bye-bye. Team, please wind up.